Gauteng Health spokesperson Motalatale Modiba joins us now for a response to that allegation made by John Moodey yesterday. Motalatale, good to have you as always. Thank you very much for your time. Section 55 2B of the Constitution, it says that those in the National Assembly, but it's a provision that is made for those in the provincial legislatures as well, must ensure that all executive organs of state in the national sphere of governance are accountable to it and they maintain the oversight of these particular facilities. Why was John Moodey's blocked from doing exactly that?
Thank you, Thabo, for having us. I think at the onset, we need to be able to indicate that we do acknowledge that the Constitution under Section 55 and Section 114 mandates both the National Assembly and the provincial legislatures the functions of conducting oversight. And we as a department obviously operate within the ambit of the constitutional framework that we have. The oversight functions as they are exercised, obviously they are exercised within a particular context, and they're not necessarily exercised over other rights that we equally have. I mean, you know that we've got hospitals, we've got schools and other institutions where you wouldn't just wake up today and go to a school and say, I'm here to conduct oversight. I need to be given a right simply because I'm an MPL. There are processes and there are arrangements that are made. And I think in this particular instance, the MPL concerned had forwarded some correspondence through their particular party, and there was feedback that was given from the office of the MEC, given that with the oversight visits, how we're structured is that those would be managed under the parliamentary liaison office within the office of the executive authority to ensure that there is smooth sort of facilitation of this kind of visits, because you can imagine that with the number of parties we have in the legislature and MPLs, if all of them just woke up and just said, we're going to go to all these hospitals just to conduct oversight without a particular process being in place, we will end up not being able to function. I mean, the facilities that they were at Sebokeng Hospital, in just a period of about 2 weeks or so, they've had 3 different oversight visits by different institutions of parliament. You had SCOPA going there, you had the appropriations select committee also going there. Those visits, when you get there, they impact obviously on the operations on the day, because by virtue of just the oversight, it means you must pull resources away from their day-to-day work and be able to assist in providing whatever information that is required. So the issue was not a matter of denial, it was more a question of coordination and timing.
Yeah. But surely one arm of government cannot say, I need permission from another, particularly a legislature needing permission from the executive to conduct oversight. That could pose a little bit of a challenge, because the legislature is operating on behalf of the people, not necessarily to appease what the executive would want them to do.
It's not about necessarily seeking permission to do oversight, but it's about coordination. Imagine, Thabo, if you were to wake up today, tomorrow, and then you just barge into a school and say, I'm here to do oversight. Let us are writing exams now. You're saying, I'm here to do oversight now, simply because you are the legislature. The Constitution does not say there must not be processes. It does say that, yes, members of parliament, members of provincial legislatures, in terms of the Constitution, they conduct that oversight. And by the way, it's not just MPLs. Remember that we've got Chapter 9 institutions that also, if you look at what the Constitution says, they also have an oversight role as part of their mandate to ensure constitutional democracy. So they exercise oversight role over state institutions. Yeah. So they also make arrangements. They don't just wake up and say, we're here now, we're here to conduct oversight, because they do understand, particularly in hospitals, obviously, yes, those are facilities where there's quite a lot of work that is done in terms of looking after patients and all of those things. And hence, there are those protocols that are in place to ensure the smooth facilitation of. I mean, we've had various oversights that are done. I just mentioned examples of 2 other oversights that were done in the past 2 weeks. Arrangements were made, and MPLs were able, and MPs were able to come in and do whatever oversight that they needed, and ask questions and get answers where they needed to provide answers. I think the issue here was just the issue around the protocol in terms of facilitation, because if we were to allow a situation where simply because I'm a member of parliament, I don't need to make any sort of arrangements and so forth. So it means essentially you might render some of these facilities not working, because on a daily basis, someone says, I wake up, I'm going to conduct an oversight at facility X, Y, and Z. So all that we're saying is that we do respect what the Constitution allows, and we are committed to working and to cooperating with all the relevant legislative bodies, including the other oversight bodies. By the way, even civil society organizations do come in to conduct oversight. You would know that with health, annually we've got organizations like Rechize who do extensive work, and they come in, they also do oversight, and their reports often are very damning. But we still give them permission, we still give them access and facilities.
Which is what made this quite an issue. Say what was the matter? Because even this same group, you would have allowed them to go to Charlotte Maxeke, I think last week. You would have allowed them to go to Tembisa Hospital some other day. So they've already conducted these oversight visits twice already in the space of 2 weeks. But what was particularly different here? Because one, they would have sought to inform the MEC, I think on 2 occasions they're telling us, to no response, only to get to the hospital and be told explicitly that the MEC said they should not be let in.
I don't think it's true that there was no response. There was a particular correspondence that was given from that office. So sometimes when you communicate with the office to request to say you're coming on a particular day, it's possible that at that particular time, access, you might get an answer that is not necessarily favorable. It's not that there was no response. There was a response. Perhaps maybe the answer or the response was not one that they were agreeable to, but there was a response, because there is no way that the executive authority would not necessarily respond when MPLs are making an inquiry, or they're making one form of arrangement to another. But it is important that always with health, how it works is that obviously all of these oversight visits, because they are managed under the parliamentary liaison office within the office of the executive authority, and that's where obviously the whichever organization is coming to do oversight would correspond with that particular office, so that the necessary arrangements are put in place and they're able to have access. They are not the first. It's not the first time that we have a situation where access is not granted because of one reason or another. Yeah. But often, as you have just rightly said, access is given. So I don't think we need to go this route, this extreme route, in terms of the party concerned creating an impression that they have been blocked, they have been denied, and so forth, when they know for a fact that most of the time when arrangements are made properly, there's always access that is given, because it's in our interest to have this oversight conducted, because they also help us as a department to be able to pick up some of the blind spots, some of the shortfalls, and often the reports that come from these oversight visits are quite helpful in terms of assisting us to zoom in into some of the areas that we might not be able to maybe be aware of, or we might have looked at them differently. Yes. So we always appreciate, and I think the Constitution is quite clear, and those that crafted this Constitution were very wise to put in place these checks and balances in the system. And I think those are things that we respect and we appreciate, because they are, at the end of the day, aimed at ensuring that we improve the level of services that are given.
So one of the other questions that I suppose we would have wanted to ask is at what point, I mean, I understand you saying there are security issues. I mean, hospitals of late, they would get individuals that come in, they rob patients and so on and so forth. So there are security concerns and that would require security to deny access in some instances. Yeah, there is privacy of patients. Yes, there is disruption of operations. But at this particular instance, Mr. Moodey says, well, he said, I wanted to gain access to casualty because I've got a headache, and he was still denied.
Yeah, but why would you want to go to casualty because you've got a headache? It doesn't make sense. I mean, if you had a headache, it could have just simply been attended to. No patient, when a patient comes to a hospital and they've got a particular problem, they don't tell the healthcare workers where they want to go because they've got a particular problem. You are a patient, the healthcare workers are the ones who know that if you say I've got this type of problem, how that problem must be addressed. You don't say I've got a headache, I need to go to casualty. I've never heard of that. That on its own tells you that something is not right. Why would you want to go to casualty for a headache? Because the headache can be attended to at the clinic.
He's got migraines. He wanted to go get some pills and he didn't have his medication with him at that time.
But you can tell that that's just really pulling straws. We look forward to the further engagement with the colleagues in terms of them having access and so forth. But I wouldn't know on the day if they had a migraine and whatever. But even if they had that, they would not be in a position to prescribe to say I need to go to casualty because I've got a headache. It's the healthcare workers, the clinicians who would be able to tell what needs to, where do you need to go and how they would treat your particular condition. I think the principle that perhaps we must just emphasize is that public health facilities are accessible to the public, and oversight visits are important, but it's important that we manage them in a coordinated way, given that hospitals, by their nature, when someone says I'm coming and there's an entourage that is coming to do oversight, it's not just they are coming and they will work on their own. They will require certain resources to be attached to them. They will require us to pull certain staff, certain people that are responsible for certain units to be able to go with them to explain and so forth and take them through whatever that they would want to know. And usually these oversight visits are very specific in terms of we're coming to do ABCD. You can imagine that the hospital is a campus. There's quite a lot. You cannot just say I'm coming to do oversight. Oversight on what? Is there a specific area you are interested in? There's never an oversight that says we're coming to look at everything, because you are always specific. Because if you were to look at everything, we might as well stop operations on that day and give you that whole day and then compromise even the care. So there's always specifics whenever these oversights are done to say we are coming, we have an interest in ABC, so that we know which area we need to pull staff, we need to pull people that are going to come in and be able to assist you with whatever that you need. And most of the time we give documents, we cooperate. Like I was saying, we had SCOPA, we had the Committee on Appropriations. They spend almost half days in many of our facilities. And they had interactions with staff, they had interactions with patients. They went to specific areas where they wanted to get clarity on things, and documents had to be produced there, and presentations had to be made as well as part of the oversight process. So it's something that we welcome. But all that we're saying is that it is important that there's a level of coordination and cooperation, obviously, from ourselves as the department, and also from those bodies that are coming to do oversight.
Motalatale, before I let you go, there's a multidisciplinary task team, if you like, or task force, including national inspectors, health inspectors, and so on and so forth, that is investigating this thing of a possibility of a chemical product contained in some foodstuffs that would have been involved in the demise of 6 children in Naledi. What are you finding out? Are you at a point where you are able to tell us what is being discovered?
I'm not at the moment in a position where I'm able to share more, because what we know is that the health inspectors have been on the ground. Even today, they've been there at Naledi, continuing to do their work. So we'll just have to give them a bit more time to allow them to do their work in terms of trying to establish and track down this pathogen, as to what could be the cause. As the minister did announce today, we've roped in even your NICD as well to be able to zoom into assisting us to understand what could be the cause of these foodborne illnesses, because clearly it's not just food poisoning, and we just are waiting to see what this team that has been set up will be able to find out, because that is quite important. If we're going to decisively address this issue, it is important that we get to the bottom of understanding exactly what the root cause, so that we're pointed in our interventions. At the moment, they are still on the ground. They're doing quite a lot of work on the ground, engaging with communities, engaging with local shops and other stakeholders, so that they're able to fast track their work and collect whatever samples that they need to collect on the ground as part of the work that they're doing.
Appreciate your time. Thanks so much for coming on. Motalatale, they're speaking on behalf of the Department of Health in the Gauteng province. Let's take a break. In Focus continues shortly.